most immediate task was to look at how we could urgently deploy the most immediate support, which was, of course, support in the field of health, and how we could procure urgent equipment to help the health structures here in the country. This was done in a matter of days, and it took two dimensions. First, we had to find the funds. So we looked at what financing opportunities we had in our portfolio, and then we had to define the needs and how we could focus what we were going to do and who we were going to do it with. As soon as this track, the most immediate response, was underway, we started looking at our overall ongoing portfolio, our different programs, and we asked ourselves three questions there. First of all, is there a need to change some of the substance of the content to make them respond better to this new critical situation that we were facing? The second one was, do we need to change the working methods in terms of, for example, experts or teams who could no longer be in the country and could not meet directly their partners, their interlocutors? Did we need to make special arrangements for the work to continue? And the third dimension was, could we see how we could anticipate the disbursement of some of the funds and the operation of some of the projects and programs in order to make available some resources more quickly to those who needed our support. We had to see also with our colleagues in headquarters how we could adapt some of our instruments, some of our working methods, because of also the crisis that was declared, to make our operational mobilization faster and quick. The second challenge, apart from the internal one, is more an external one, is related to our partnership with the administration on how they wish to respond to this crisis and how they wanted to devise and design the policies and the measures that then we would be supporting in the socioeconomic recovery phase. And the third challenge is very much a country-specific challenge. There was a major earthquake that hit Albania at the end of last year, and this was a major tragedy for the country. And we were, when we started the critical phase of COVID crisis, we were fully in the design of our new programs for the earthquake recovery. And of course, this was also putting, and is still putting, a very strong strain on the administration. We had to break things down and address issues one at a time. At the same time, I also think that what helped us a lot was not looking at ourselves in isolation. And so regardless of the portfolio distribution, we really looked at having a team, different clusters on the different areas of work that I highlighted before, so that we could work in parallel and mobilize all the resources we had in-house. And then also not just work in isolation internally, but also look at what other partners can do. In terms of coordination in Albania, we have a good cooperation, certainly a good cooperation among EU member states, the EU delegation, and also other strong partners of Albania who have a very strong engagement with Albania. They're not EU member states, but they also very much see their role in the country as helping Albania move forward in its EU path. There is very strong coordination, and we are favored, we're helped, if you want, by the fact that there is this common policy objective, which is how do we help the country move towards EU accession.